In the 50s, Canadian researchers were considered world leaders in the use of psychedelics to treat mental health issues. But in the 60s, you couldn't mention these drugs without thinking of hippies. Today, there's a second wave of this controversial treatment, and it's showing promise. Mike Drolet reports.
It's meant to mimic a sensory deprivation tank, blindfold, headphones, and as you sit back in the zero-gravity chair, the psychedelic effects of ketamine take hold.
Tune in and drop out.
In the 1960s, recreational LSD pioneer Timothy Leary spurred an entire generation to embrace cultural change through psychedelics. And while the counterculture movement got high, the US and Canadian governments weren't feeling the same buzz. All research into the clinical benefits of psychedelics ceased, and the drugs went further underground. That is, until recent years, when scientists began looking for alternatives to antidepressants.
The need exists because there are so many people struggling with depression and anxiety and other mental health conditions.
MDMA, known on the street as ecstasy or Molly, has shown promise in treating PTSD, as have clinical trials looking at psilocybin or magic mushrooms to treat depression. The only psychedelic legal for medicinal use in Canada, ketamine, is the primary drug being used at Toronto's Field Trip, the first psychedelic-enhanced therapy clinic in Canada aimed at patients for whom antidepressants have stopped working. Unlike pills like Prozac, which are taken daily, the psychedelic model involves multiple sessions where patients are dosed and then treated.
The current model is, we're going to give you pharmaceuticals, they're going to numb your experiences. So we're going to just numb your sadness. We're going to also simultaneously numb your joy. And what we're trying to do is rewire the brain in a healthy way. And you need a therapist guiding you to do that.
Canadians are among the highest consumers of antidepressants in the world, trailing only the US, Iceland, and Australia. But antidepressants, because of their side effects, are as controversial as they are popular, which in turn has fueled interest in largely unproven psychedelics.
We have almost no long-term research. So just because you feel incredible, right after a trip or even a week after a trip doesn't tell us anything about what's going to happen to you in 6 months, a year, or longer.
Canadian researchers in the 50s were digging for those answers. Almost 7 decades later, the 1 in 10 Canadians who rely on antidepressants are hoping today's doctors find what they were looking for. Mike Drolet, Global News, Toronto.